Mike Roizen. I'm chair of the Wellness Institute at the Cleveland Clinic, and I have the privilege of being at the University of Minnesota talking about well-being today. Your real age is the actual age of your body. It can be older or younger than your calendar age. And the great news is that you get to change it by your habits. Yeah, your genes influence it, but you, to a large degree, influence your genes. So, for example, if you smoke, the average 1 pack per day smoker is 12 years older. So if you're 45, you're 57. That's both in a mortality and disability combined. So you're equivalent to someone who's got the risk of dying and the risk of disability who's 12 years older. The big four are stress, food choices and portion size, physical activity, tobacco, and then a fifth is sleep and how much you sleep. So one of the unrecognized ones is that, and then of course managing chronic disease is up there in the top 6 things you can do that make a difference. The great thing about it is it prioritizes for you any way you want. So you can prioritize from most important to least important, from easiest to do to hardest to do, for choices you want to make. And no one should make more than 3 choices at once. You try and do 17 things, you're going to fail at all 17. So we usually say pick 1, 2, or 3. Once you master those, then add another and another. And the people come back to see how they're getting younger. One of the reasons that television watching ages us has nothing to do with the fact it's TV. If you're on an exercise bike or an elliptical, or you put your rowing machine in front of the TV and are doing it while the TV's on, you're not aging, you're actually getting young. The key in doing TV, if you're going to sit on a couch, you have one of the great ploys we do when we're doing do-overs with patients. So we do do-overs, and some of the things we do, and when we visit their home, is we tell them to take the couch out and put a treadmill and a exercise Schwinn bike. It's an inexpensive thing. Or put just a pulley machine or a set of weights. Every time commercials come on, you force yourself to exercise for that, depending on the program, 3 to 4 minutes. So the average 60 minutes of TV viewing, if you watch Oprah, if you did watch Oprah, the Dr. Oz show now, it's 41 minutes of TV. What does that mean? It means you got 18 or 19 minutes where you can do exercise every hour, only doing it during the commercials. So and it's 3 minutes if you want. If you want to do 3 minutes of intense exercise, first commercial is do push-ups. Second commercial is do sit-ups. Third, do some other exercise that you want to do. We found there were 5 steps that were necessary to get behavior change in consistent fashion and to sustain it in our own employees. The first is to know you get a do-over. You get to change your life if you want to. You get to control your genes. When the Human Genome Project was done, we thought there were going to be 300,000 genes. That's how much DNA we have. But there's only 22 to 30,000 genes. So what was the rest of the DNA? People called it junk DNA for 10 years until about 1.5 years ago, the ENCODE project found that it was actually switches. 90% of the rest of that DNA is switches that control your genes, that turn on or off your genes. And the great news is you get to control most of those switches. Secondly, it is change your environment, and that's the key thing. If you buy a box of Chip Ahoys, you will eat that box. Right? You say, I can do moderation. I can have 1 Chip Ahoy today and 1 tomorrow. Very few people can do that. So you've got to change your environment to not have things that are harmful to you. The third thing is you've got to have programs that you enjoy doing that are able to. So if you like playing Wii Fit, get the Wii Fit and figure out who the opponent is you like playing it, so that you're going to keep doing that physical activity rather than saying, okay, all I got is a rowing machine and I don't like rowing, so I'm not going to do it. You've got to find something, programs that you like. The fourth thing that we needed for our employees is, if you've got a problem, you got type 2 diabetes, you got osteoarthritis, you've got to find a physician who's not just treating the symptoms, but is trying to go at the basic cause of that so that you can reverse it, so you don't have diabetes or don't get rid of the osteoarthritis. Not just the pain, but get rid of the basic problem. And the fifth thing is, we had to do extrinsic motivation. You love people who just have intrinsic. I want to get healthy because it's healthy for me. But even with cigarette smokers, many won't quit because they don't have a intrinsic motivation to quit. So you need to provide a reward system. And whether that's a reward system that the family does together, saying, if I have 5 normals, normal blood pressure, normal LDL cholesterol, etc., I'm going to buy myself an extra spa vacation, or I'm going on an extra week with my wife, or I'm going to buy a new outfit or something. Or whether it's extrinsic provided by an insurance company, you get a $2,000 rebate on your costs if you get 5 normals. We found you've got to get some extrinsic motivation to get above the reptilian brain so that you think about things and don't revert to the addictive behaviors that you had before. There are 2 major things, 2 major types of stress that age us. It is major life events. Someone dies in the family. A relative gets sick. You're sued. You have financial problems. You're forced to move. You're forced to take a new job. And the other are nagging unfinished tasks. Now, there are 2 ways of handling these things. One is you do the nagging unfinished tasks. Okay? There was this torn screen door that I would come through every night at home. My wife would say, do you want me to get it fixed? And macho man, no, I'm going to get it fixed, and I'll fix it. After 2 years, she finally got it fixed, but every night I would see that darn thing and coming home, and it would bother me. That's a minor, nagging, unfinished task, but those age us a great deal. The other thing is those major life events, and whether it is a boss yelling at you, it's your perception of what a major life event for you is. And it isn't the event, it is your response to it. And what is stressful to you may be joyful to me, or may be no event to the other person. So it is your perception of the individual event. There are 8 different techniques we teach: guided imagery, progressive muscle relaxation, breathing, focused words play, if you will. Most people will play with one. Mine is breathing. So when I see an event that is going to cause me stress, for me, one of the nagging unfinished tasks is, I hate driving and having to wait in traffic. So I will do either a meditation during that period of time, or I'll do deep breathing during that time, but it will be something that I will be just a little aware of where I am, so that I am not hazardous to anyone else, but I also will meditate through it so that that otherwise stressful event is nothing to me. Remember, well-being is a joy. It's a wonderful event. It's not sourdough. Most of us think of medicine as sourdough. Don't do this, don't do that. Instead, you've got to reframe it to being something that's fun, scientifically valid, but fun and edgy. Make, if you will, whether it is managing stress or physical activity or choosing foods, make them all fun. So find a fun sport that you love doing that gets you exercise in all 3 components, or at least one of them, and then take the other 2 as jobs. If you will, when you're cooking, learn to cook so that it's a joy to find something that you love to eat that is healthy. In managing stress, think of that thing that is really joyful or edgy or fun for you. So remember, Being well is one of the great privileges, honors, and joys of life.